All right, let's jump right in. We're talking about a really serious medical emergency today, one that's notorious for hiding in plain sight. It's called aortic dissection, and we're going to break down exactly what makes it so dangerous. Okay, I want you to just imagine this for a second. A pain that comes out of nowhere, it's sudden, it's severe, and it feels like something is literally ripping or tearing apart inside your chest or your back. That terrifying feeling, that's the classic sign, the number one red flag we're going to be digging into today. So, what on earth is causing a symptom like that? What's actually going on inside the body's main artery to create such an alarming feeling? Well, that's aortic dissection. The easiest way to picture it is to think of your aorta, your body's biggest artery, as a really high-pressure hose. Now, imagine a small tear forms on the inside layer of that hose. The sheer force of your blood pressure starts pushing through that tear, literally splitting the layers of the artery wall apart and carving out a new false channel where blood isn't supposed to be. It's basically a catastrophic plumbing failure, and it's happening inside your body. Now, you might be thinking, this must be pretty common, but it's actually the opposite. And this is really key. Look at these numbers. For every single person who comes in with an aortic dissection, doctors are likely seeing almost 70 heart attacks. And that's the problem, right? Because it's so rare, it can be a real diagnostic puzzle. Its symptoms can look a lot like other, more common things. So even though it's rare, there are definitely things that can up your risk. The biggest one, by far, is long-term high blood pressure. I mean, it's a factor in about 3/4 of all cases. But, other things can play a role too. Things like certain genetic conditions that make your body's tissues weaker, like Marfan syndrome, or even just having a structural issue with your heart valve. In some cases, a major trauma to the chest can even trigger it. Okay, so we know what it is and what the risks are. Let's get into the nitty-gritty of how this single tear spirals into a full-blown life-or-death race against time. It really is like a devastating domino effect. First, you've got a weak spot in the wall of the aorta. Then, boom, a tear happens in that inner layer. Immediately, high-pressure blood just rushes into that opening, and it starts tunneling a new path, that false lumen. And here's the real danger. As this false channel fills with blood and expands, it can actually squeeze the real channels shut, choking off the blood supply to your brain, your kidneys, basically any vital organ. And this leads us to what is maybe the single most critical point of this whole thing. Not all dissections are created equal. It's not just that it happened, it's where it happened. The exact location of that initial tear changes absolutely everything. How dangerous it is, what the treatment is, the whole 9 yards. And this is where doctors use something called the Stanford classification to divide them into two main types. You've got type A, which is the more common one, happening about 2/3 of the time. This is a tear in the part of the aorta that comes right off the top of the heart. This is an absolute drop everything, get to the OR now surgical emergency. Then you've got type B. This tear is farther down the aorta in the part that runs down your chest. This one is typically, not always, but typically managed with powerful medications first. So you can see the stakes, but we already said it's a great mimic of other conditions. So how in the world do doctors figure this out when every single second counts? How do they solve this puzzle? Well, the first step is listening really, really carefully to the patient. They have to tell it apart from things like a heart attack or a blood clot in the lungs. And the biggest clue is the quality of the pain. People describe a heart attack as a crushing weight, like an elephant on their chest. But with a dissection, they use those very specific words: tearing, ripping, stabbing. That description alone is a massive piece of the puzzle for the emergency team. From there, it's a super fast diagnostic process. They might start with a chest x-ray, which can sometimes show a subtle hint, like the shadow of the aorta looking a bit wider than normal. But to really know what's going on, they need the gold standard test, a CT angiogram, or CTA. They inject a special dye into your veins that lights up your blood vessels on the scan. And with that, they can see it plain as day: the tear, the false channel, the whole mess. It gives them the roadmap they need. And the second they see that on the scan, the diagnosis is confirmed. And that's when the real race begins, the race to stop that tear from getting any worse. And that treatment plan goes right back to those two types we talked about. If it's a type A, it's all hands on deck. The goal is to prevent the aorta from literally bursting right next to the heart, so it's a trip straight to the operating room for emergency surgery. But if it's a type B, the first move is usually medical. They hit you with powerful drugs to bring your blood pressure and heart rate way down, which takes the stress off the aorta's wall and hopefully stops the dissection in its tracks. And why is every second so critical? Because this isn't just about the aorta itself. That false channel can block off arteries branching off to anywhere in the body. If it blocks blood to the brain, you have a massive stroke. If it blocks the arteries to the heart, you have a heart attack. And the ultimate fear, of course, is a complete rupture. That is almost instantly fatal. So yeah, every single second counts. So after all this, what's the one thing you need to take away? We've seen how this thing is a master of disguise, how it's incredibly dangerous. The single most important action is to remember the symptom, that sudden, severe, tearing or ripping pain in your chest or back. If you or anyone you're with ever feels that, don't second guess it. Don't try to tough it out. Treat it as the medical emergency it is and get help immediately. Because in this race against time, that awareness, that simple act of calling for help can make all the difference.